Kimberly's 46 years old. We're going to go ahead and do Renuvion today to really get her a nice sculpted face. Typically, we tell patients that they will have about a 60% improvement, and the younger you are, the healthier you are, the more that is true. Looking good. So, things we need to worry about, chin way up for me, are the marginal mandibular nerve. And so as we're coming over as it's coming over the facial artery, we'll go ahead and start to worry about its superficial appearance right here. And so we'll stay very superficial right here. We're going to evaluate how far her treatment area is going to be, and it'll be right up to here. And right up to here. Turn to the left. So in terms of anesthesia, typically we do everything in office. We're using 15 milligrams of Valium on 99% of patients. We use Pronox, a 50-50 mixture of oxygen and nitrous for most patients. And then just a Klein solution tumescent after our injection of local lidocaine with epinephrine. Our Klein solution is typically at around a 750 milligram per liter bag, and we'll use around 250 cc's per case for the neck. And again, this is just 2% lidocaine with epinephrine. Good. And we'll go ahead and lean her back. You can use betadine or Hibiclens or really any skin prep to make sure that you maintain as much sterility as possible. And then we have these preset kits with sterile towels, surgical towels, that we'll use to drape the patient. This is the split pad, the grounding pad for the Renuvion unit, which you need to attach for every case. A 15 blade is used for our submental incision. And tumescent anesthesia, again, we're using a 750 milligram per liter concentration, chin way up, on an infusion pump. Little pinchy, how's that, okay? Mm-hmm. And notice we're infusing in an anterograde fashion. Here we're using a rate of 250 cc's per minute and trying to really tumesce our treatment zone. Not only is the tumescent going to help with control of pain and bleeding, but it's also going to help with the transmission of the plasma and radiofrequency energy provided by the Renuvion unit. How is this, okay? Mm-hmm. Turn to the left. For surgeon preference for tumescent is varied. I like a tumescent pump or infiltration pump to allow me to generously, evenly, and easily apply the tumescent in the subdermal plane. And again, we'd use about 250 cc's, and I use these blunt 17 gauge cannulas to allow me to get into the most superficial zone. And here again, I'm perfusing the tissue in an anterograde, infusing the tissue in an anterograde fashion. A little difficulty right there. We'll redirect. And you can go as far as you need to, as long as you're staying superficial to avoid any nerve injuries. Turn to the right for me. Okay, here we go in her lobular crease, right here. Here we are again. in a very superficial plane. Again, this is a 17 gauge infusion cannula, and we're going to infuse all of the area, including over the sternocleidomastoid. Being superficial and knowing your anatomy is the most important thing. We know that the marginal mandibular nerve starts to become superficial right over its path as it crosses over the facial artery. And so basically from here, almost midway from our incision point to the marionette line is where we start to worry about the marginal mandibular nerve. And so we'll tumescent, and the tumescent is actually going to give us a nice safety plane between our treatment zone and the nerve, allowing us to minimize the physical trauma to the nerve. So we'll do 3 ports, and it helps us with access to treat the whole neck, but also, very importantly, helps us treat any gas egress, or helps to promote as much gas egress as possible. Okay, now we're going to pre-dissect. We can pre-dissect with blunt instruments, with ultrasound instruments, laser instruments, but not with the Renuvion cannula. Many different cannulas can be used for dissection. Chin way up for me, hon. Here we're going to use a spatulated cannula, and you'll just use the spatulated cannula to create your dissection plane in preparation for your Renuvion treatment. We'll do pre-dissection a little bit and create our space with dissecting scissors, and then use our cannula to dissect. And you can use a basket cannula or any other dissection device, typically not a pickle fork, but you want to dissect all the way down to the platysmal plane and to the superficial plane as well, in preparation for your Renuvion subdermal plasma application. Chin way up. So here we are using ultrasound energy to do a little bit of lipolysis, but more importantly to do our subdermal dissection as well. I'm using a 5-ring handpiece at 70%. Very important to keep in mind when you're using multiple energy modalities that you have to be a little bit more weary of the amount of energy you're using for each one of these, as a combination could create a significant thermal load. The right for me, scissors. Okay. We've already made our 15-blade incisions, but we're going to go ahead and dissect here a little bit more just to prepare for gas egress. This is the point at which the greatest amount of resistance is found. There you are, right there. Okay. Chin way up for me. And the gas egress is going to want to preferentially come this way, and so we're going to prepare our incisions to prevent emphysema from traveling down to the chest or any other place. And now we can go ahead and do our Renuvion application. So the Renuvion handpiece comes in 2 sizes. We're going to use the 15-centimeter one, appropriate for the neck and face treatment. This is a 3-millimeter diameter handpiece. Your assistant is going to ensure that the grounding pad is secured onto the abdomen or legs or arms. And then we're going to go ahead and activate. And so we're going to go ahead and zero out the machine on the non-Renuvion side, the monopolar and bipolar, and plug in the handpiece into the Renuvion side with a power level of 60% and 1.5 liters flow rate. Below that 3rd level, that 3rd point, is a joule counter, and typically at 60% power to 80% power, you'll have about 1 kilojoule per minute to 1.4 kilojoules per minute. And so it'll allow us to see how much energy we're deploying underneath the skin during our treatments. We're going to check for faults at this time, which include a device or a handpiece that's not been plugged in completely, to ensure that the grounding plate or the grounding pad is secure, and then to just activate just gently the plasma flow. Chin way up for me, hon. And we're going to insert the handpiece just proximally and just test egress. And as you can see, there's gas coming out, but it's egressing through here, and we also hear it coming out through the insertion point as well. Chin way up for me. and now we're safe to advance the handpiece. We're moving at 3 centimeters per second right here in a superficial plane. Those were each individual strokes in a retrograde fashion, and this one group of strokes makes one superficial pass. We're going to go a little bit deeper here and do sequential strokes to get a deeper pass. And so notice that I'm going ahead to milk any excess gas, helium, from these passes. Here we go again. We're going to go ahead and go anterior. We know that we have nice movement, no obstruction. We are going to get to the distal point. Here there's an obstruction. If you activate it, there can be an occlusion or an endpoint burn. So we'll bring it back just a little bit and then just activate in retrograde fashion in these serial strokes. Notice that we are not adding too much energy to this point right here, but we are pretty superficial. Now we're going to go deeper here for our deeper pass. Our sequential strokes comprised of deeper passes of Renuvion. So I want to see a contraction event on the table, and that's when we know we've stopped. And you can actually feel to see where the movement still exists, and we'll go ahead and treat those areas with the Renuvion energy to really control the coagulation. Beautiful. Again, we're going to make sure that our insertion point has enough space for gas egress. We're going to activate proximally, and we notice that the gas is coming out. There's no emphysema. Now we can go ahead and safely introduce the handpiece and activate the handpiece in a retrograde fashion in our serial strokes right here, which create one pass. So in this case, we'll see that there is quite a bit of movement and space here, and so we'll treat overlying and posterior to the sternocleidomastoid. Here you can see a significant excavation here on the right-hand side, and you can see how tight this is compared to the left-hand side. This is my clinical endpoint. Look at that difference immediately. And I'm pulling as hard as I can. Okay, so we're going to go ahead and do these anti-retrograde passes. And we're not going to repeat overlying the areas that we've already treated because of the potential for thermal buildup and burns. And so if we've already treated these areas, we're going to minimize any cross-hatching. These areas right here, if you come from the midline and from the lateral side, you can inadvertently get too much energy delivery right here. Chin to the center, chin way up. And so here you can see that the indicators are warning you that you're just about to come out of the incision. And as you see the first one, be prepared and go ahead and turn it off at this point so that you don't inadvertently apply energy to the external surface of the skin outside of the port. We've done about 3 joules of energy on the neck at this point, and you can see the position of the tissue at this point, significant improvement in the appearance of the neck. Turn to the left for me now. Now we're going to go redirect our attention to the jowl. We're going to go into our port again, double check and make sure that there's egress posteriorly. And there is. You don't see the significant inflammation or emphysema occurring. And we're just going to walk this up and just bring it into a retrograde fashion. Additionally, you can go ahead and use pressure on the distal aspect of your treatment zone to prevent gas egress into the areas that you're not wanting to treat. Again, we're going to check to make sure that we have appropriate egress. There, we've activated in the most proximal part of the incision. You can use a second hand to prevent the egress or the movement of the gas towards the area of the face. And remember, we're doing these strokes in a retrograde fashion to prevent inadvertent gas collections where you don't want them. Here we go. And any excess gas we can go ahead and remove. So here we are. Our treatment looks pretty good. And chin way up for me. Now we're ready to aspirate a second time and remove any potential remaining fluid. So remember to aspirate any remaining fluid or fat that may cause an inflammatory response after the healing period. And here we are, a little bit after your treatment. While I'm down here, I'll get way down here to get some fat. All right, and so after the chin way up for me, chin way up, way up as much as you can. And so we've reached our clinical endpoint, and we're going to go ahead and wrap the patient. We don't normally suture our incisions closed, although if you do, just one suture in each port. And we don't typically put our patients on oral antibiotics. We leave the wrap on for 3 days straight, and then 2 weeks at bedtime with a very quick resolution. Tomorrow she'll look pretty impressive. We're going to go ahead and do a little bit of gas egress, that last little bit of massaging to get any residual gas out. She did have 250 cc's of tumescent, of Klein solution, and so you will see some periauricular tumescent there, and then distally here. And then we're going to use a latex-free foam. Chin way up for me, hun. We'll use this to bandage and help compress some of those edematous areas.
Lean forward for just a minute.
Lean forward. Big smile for me. Good. No marginal mandibular involvement. And let's have you sit forward now. All the way forward. Good. And you'll be ready probably tomorrow. It should look very beautiful, and just no alcohol tonight. Lots of protein and no blood thinning nutrients like ginkgo, garlic, ginseng, green tea, multivitamins, fish oil. What'd you think?
It was good. Yeah, didn't hurt. It was, I wouldn't say relaxing, but it was, it was completely fine.
Good.
Thank you so much.
You're welcome.